Hello, Alex here with another instructional video. This time on the female reproductive system. So if you haven't watched any of these videos before, my name is Alex Flood. I'm a radiologic technologist, and I work for Central California School of Continuing Education, teaching the medical assisting and X-ray technician programs. So let's go ahead and get going. All the information today is out of the Language of Medicine textbook that our medical assistants use. This is the 11th edition and written by Davy Ellen Chabner. So, quick introduction to this. Sexual reproduction, it's the union of the nuclei of ovum and sperm cells. So each ovum and spermatozoon each carry 23 chromosomes. When they combine their genetic information, those 23 chromosomes each, to make 46 chromosomes, 23 pairs, and those 23 pairs of chromosomes begin dividing and building a zygote, which will end up turning into a small little baby. So that's sexual reproduction. It's the union of the nuclei of an ovum and sperm cell. Ovum and sperm cells collectively can just be called gametes. So we can say that gametes are created by the gonads. And as I stated, each gamete contains half the number of chromosomes of a normal body cell. So that when they combine with the other gamete, they can make one complete body cell. Gametes are produced in the gonads. The female gonads are the ovaries, the male gonads are the testes. So the word gonad just refers to the organ that creates the reproductive cell, the sex cell, not any of the accessory stuff. So for females, that doesn't include fallopian tubes, uterus, cervix, vagina, labia, all those other external things. For males, testes, so that does not include vas deferens, scrotum, penis, your various ducts, your ejaculatory ducts, and so forth that are considered that are part of the male systems. When we say gonads, we just mean the organ that produces the sex cell. So in females, that's the ovaries, and males, those are the testes. Fertilization. Fertilization happens in the fallopian tubes, and so an ovum leaves an ovary and travels through the fallopian tubes. If this is timed right, sperm, which there are several hundred million sperm during any one ejaculation, and several hundred million sperm will make their way through up through the cervix, up through the uterus, and into the fallopian tubes. And if it happens at the right time, a sperm cell, a spermatozoon, will meet up with an ovum, and the sperm cell uses a little enzyme on its head, which is called acrosome, and that little enzyme basically erodes away the wall of the ovum, and it can get inside and then introduce its genetic information into the ovum. So fertilization takes place if the sperm cell is present and unites with the ovum. The fertilized egg will then implant and divide to form a ball of cells called a zygote, later called an embryo, and even later down the road we call it a fetus. So this is a quick view on the female reproductive system. You're looking at a sagittal plane of the body. This is more correctly the mid-sagittal plane of the body, a plane that divides the body into equal left and right. You'll notice that the female reproductive organs are in the pelvic cavity. So number one, we're looking at the ovary, a single ovary. Every female has two. A single fallopian tube, which every female has two. Again, this is a lateral view, a sagittal view. We're going to look at an anterior view here in a moment. This view is really useful for looking at the anterior-posterior alignment of placement of organs. So noticing that the bladder is anterior to the uterus is important, especially for our sonography students who use the bladder, the full bladder, as like a window to see the uterus through. So there's the fallopian tubes, the uterus. They're pointing more at the myometrium, the muscular part of the uterus, but the uterus nonetheless. The cul-de-sac, the area behind the posterior to the uterus and anterior to the rectum. The urinary bladder shown filled with urine there. The cervix, shown as the basically the most distal inferior point of the uterus, which is introduced into the proximal vagina. Pubic bone sitting anterior to the bladder. Urethra, for females the urethra is short and leads to the external urinary meatus. Under that, number 5 listed the vagina, the vaginal canal, and during birth this will become the birth canal. The clitoris, a organ involved in sexual stimulation. Bartholin glands, which are small glands near the distal vaginal canal, which provide a lubricating type, a mucousy type lubricant. And number 8, the perineum, just the skin, posterior to the vagina and anterior to the anus. Okay, anterior view of the organs of the reproductive system for the female. Let's go ahead, just go clockwise around this. So we're looking at the corpus at roughly the 11 o'clock position, 10, 11 o'clock position. That's the interior of the uterus. The fundus is the top of the uterus. The fallopian tubes and fimbria. The fallopian tubes are where the ovum passes through to get into the uterus, and fertilization should happen in the fallopian tubes if we want implantation to happen in the uterus. So you'll see the sperm cell, the spermatozoon, and the ovum meeting up there. The fimbria are finger-like structures that hang, and this view is not very good, but in all actuality, they sort of sit on top of the ovaries, and those fimbria have this kind of rhythmic motion that they make that creates currents in the peritoneal fluid and will draw the ovum, the ovulated ovum, up into the fallopian tubes. So it's interesting to see there, you see number 4 labeled the ovum, and that little ovum is actually out in the peritoneal fluid when ovulation occurs. So this little guy here is out in the peritoneal fluid when the ovary ovulates it, and it has to be swept up into the fallopian tubes to make its way through the fallopian tube and hopefully get fertilized somewhere in here and implant somewhere down in the corpus. This ovary on the screen right, patient's left, is showing the various stages of ovarian follicles, ovulation, corpus luteum, and so forth. So there's your ovarian follicle, sort of in a clockwise order. You have the ovarian follicle maturing, rupturing and ovulating, and then staying behind the leftover follicle, now called the corpus luteum. That stays behind to keep the body in a state of being ready for pregnancy. It continues to produce estrogen and progesterone, which keep the uterine lining thick and the body prepared for pregnancy until pregnancy does or does not occur. If pregnancy doesn't occur, the corpus luteum degrades and is reabsorbed. If pregnancy does occur, the corpus luteum persists for longer until the placenta has a chance to grow and start producing its own hormones to continue on pregnancy. Number 2, the utero-ovarian ligament, the ligament that is anchoring the ovary to the uterus. Shown kind of hazy here is the broad ligament, which anchors the uterus in place. Uterine arteries and veins. And vagina, shown here as number 13, with the cervix introducing into the proximal vagina. Uterine serosa, which is the inner lining of, the outer lining of the uterus, pardon me. Myometrium, the muscular part of the uterus, and endometrium, the inside of the uterus. The endometrium is interesting because it has to build up and slough off monthly on a monthly cycle. So it actually has 2 layers. We call things that have layers we call them stratified, or in this case it's a single layers, individual single layers, so we call them stratum for singular. So there's a stratum basal, and that's the base layer, and then there's the stratum functional, which is the top layer that actually sloughs off each month. So the endometrium has 2 layers, stratum basal, stratum functional, and then the uterus itself, so the entire uterus itself, labeled number 8. Okay, Another organ of the female reproductive system is the breast. We know the breast is there for lactation and to provide nutrients for the infant after it is born. The breast is mostly fatty tissue with glandular tissue and ducts leading to sinuses that lead to the milk ejaculatory duct. Mostly fatty tissue, though. Posterior to all the glandular and fatty tissue, you have 2 layers of muscles. You have pectoralis muscles, major and minor. Major is anterior, minor is posterior. And posterior to the pectoralis minor, you have the chest wall consisting of ribs and intercostal muscles. Posterior to all of that back here, you're going to find the thoracic cavity with the heart, the heart within the mediastinum, various other structures, the lungs, and organs of the thoracic cavity. Okay, menstruation and pregnancy. The menstrual cycle. So this is important to understand for medical assistants, because one question we have to ask our patients on patient interviews is, when was the first day of your last menstrual period? Often when I ask this question in class, and I have mostly females, but when I ask this question in class and I ask, if I ask you when was your last menstrual period, would you tell me the first day or the last day? The most common answer is they want to tell me the last day, because that's what's most important to a female. When it starts, not so important. When it finishes is the important thing to a female, because hey, it's done now. But for medical purposes, we ask the first day of the last menstrual period so that we can get an idea of if you could be pregnant or not. So let's take a look. The menstrual cycle, day 1 through 5. This is the phase of the sloughing of the stratum functional, the top most, the innermost layer of the endometrium. So blood cells, endometrial cells, glandular secretions are all discharged from the body through the vagina, and that's the bleeding that we know as the menstrual period. After that, estrogen aids the repair of the endometrium. The ovum grows in the follicle, so several things are happening. You have the endometrium repairing, and you have the ovarian follicle maturing so that it can eventually ovulate a new ovum. And it's important also to remember that several ova are developing at the same time, and one will outgrow the rest, and that's the one that ovulates. Days 13 through 14, the egg leaves the ovary and passes through the fallopian tube. This is ovulation. So the ovarian follicle ruptures, and the ovum is out now in the peritoneal fluid. The fimbria of the fallopian tube sort of sweep and move the ovum into the fallopian tubes, and the egg moves through the fallopian tubes. And maybe fertilization happens. Day 15 through 28, the corpus luteum secretes progesterone, and the uterus lining builds up in expectation for pregnancy. So I really like this little diagram here that kind of shows it. So from left to right is time moving forward. There's a top row for the ovary and a bottom row to show you what the uterus is doing. The colors, relative colors here, yellow and white, show you what estrogen and progesterone levels are doing. So some correlations here. The ovarian follicle at its most immature is right after the menstrual period ends. So the menstrual period happens, the uterine lining sloughs off, and the uterine lining's at its thinnest. Estrogen and progesterone levels slowly increase as the ovarian follicle matures, and the endometrium repairs itself and gets thicker and thicker and thicker. At the day of ovulation, roughly day 13-14 here, the ovarian follicle ruptures, the ovum moves out into peritoneal fluid. Progesterone and estrogen levels are at some of their highest. And for the next couple of days, the endometrium stays fully built up, expecting that this little ovum is going to get fertilized. The thing that's keeping the endometrium built up here is the corpus luteum. Corpus luteum. The corpus luteum will stay behind and continue to produce estrogen and progesterone in preparation for pregnancy. If pregnancy does not happen, the corpus luteum degrades, estrogen and progesterone levels drop, so the corpus luteum goes away, and the uterine lining, the endometrium, begins to break down. And this is the menstruation happening now. Okay, so we're back to the menstrual period again. This entire cycle takes about 28 days, and we always want to know when the first day of the last menstrual period was, so we can track when the last menstrual cycle took place. So pregnancy. It's an interesting thought that, of roughly, several hundred, figure 400 or 500 or so, menstrual cycles in a female's lifetime, less than 1% of those are going to result in pregnancy. I mean, on average, a female is going to have about 2 children in her life, and I don't claim to have the exact number there, but that's a pretty good average. About 2 children is to be expected. Everyone knows families that have 8 or 10 kids, and everyone knows families that have no kids, and a lot of us are somewhere in between. Most of us have a couple of kids, so that's pretty normal. So figure several hundred menstrual periods in a life. 2 or so of them turn into pregnancy, or 2 or so times there's a pregnancy and no menstrual period. So pregnancy being very rare is interesting because the body is always preparing for that. Every month a female's body is getting ready for pregnancy. So if fertilization occurs, the egg implants in the uterine endometrium, the placenta forms and attaches to the uterine wall. The amnion develops to hold the fetus in what's called an amniotic cavity, and nutrients, oxygen, and waste are then exchanged between the fetus and mother. The placenta then begins to produce human chorionic gonadotropin, which is that hormone of pregnancy that we test for on pregnancy tests, the urine pregnancy tests. So implantation in the uterus, in A. So we know that, because I explained it earlier, that fertilization has to take place in the fallopian tubes, so that when the ovum, the fertilized ovum, gets into the corpus of the uterus, it is now a zygote. It is now a blast of cells. It's a grouping of cells and little blastules, little reproducing cells that can then implant on the wall of the endometrium and then form that placenta and amnion. And so the placenta, chorion, and amnion membranes. The amnion is the innermost membrane, and the fetus resides within the amniotic cavity, and an umbilical cord develops with arteries and veins attached to the placenta. The placenta is attached to the endometrium, and that's the way that mom feeds baby and removes waste from baby. Outside of that is the chorion, the chorion, and those are the layers that surround the fetus during development. Outside of all that's the uterus, and eventually the fetus will take up the entire uterus at full term. Okay, so during pregnancy, progesterone maintains the placenta development. So the corpus luteum stays behind to continue to produce progesterone, and once the placenta develops enough, it produces its own progesterone. The uterus expands as the fetus grows, and normal delivery position for babies is cephalic, that is head first. Notice we're skipping a lot of the in-between, and that's okay, because for medical assisting we really want to know about how does pregnancy happen and how does birth happen. The in-between is more specialized, and you'll learn more about that for my medical assistants. You'll learn more about that when you get to the ultrasound section of your program. Yeah, really, we need to know about how pregnancy occurs, when the first day of the last menstrual period was, and how does what happens when birth takes place. So there are 3 phases to labor, and I'm making this extremely simplified, but that's okay for our purposes. 3 phases of labor: dilation and thinning of the cervix. The infant's head is presenting in a cephalic presentation, ideally, and that cephalic presentation and contraction of the uterus pushes down on the cervix, basically pulling it apart, dilating it, and thinning it out. We've all heard of, like, you go to somebody in the family's having a baby, you go to the hospital and you hear, she's only 8 centimeters dilated, it's not time for her to push yet, we can go home, or something like that. And we all know that at that 10 centimeter mark, they say it's time to start pushing. So the uterus dilates a specific amount, and then once it reaches that width, that dilated width and thinning, it's time to start pushing and birth the infant. So phase 2 is the birth of the infant. Okay, that's usually the biggest phase, is birth of the infant. And phase 3, after that, the placenta is delivered. So figure A shows cephalic presentation of the baby, usually face down, and that works better so that the baby can sort of kind of maneuver out of there. You see how the head could sort of flex backward, and the shoulders can kind of tuck together, and the baby kind of comes out like that. The head is the largest part of the baby, and the bones of the cranium overlap each other, compressed together during the pathway through the birth canal, and that allows the large head of the infant to come out, and then that's why you see a lot of infants with that cone-headed appearance right after birth. Shortly after delivery of the infant comes delivery of the placenta. So the detaching placenta with the amnion ruptured, and the umbilical cord is cut, usually prior to that. So the baby is given to, cleaned off, given to mom, and later after that the placenta is delivered. Okay, hormonal interactions. So things that are being done by an area in our brain to cause ovulation. So for females, and this is true for males too, follicle stimulating hormone and luteinizing hormone are there in males too. They do a sort of a different thing. But for females, the pituitary gland, it's a gland in the brain. The pituitary gland is about the size of a pea, and it's your master gland of your endocrine system. It controls all of the endocrine organs. So it produces a couple here that are important to us. FSH, follicle stimulating hormone, does what it sounds like. It stimulates the ovarian follicle to mature. Luteinizing hormone increases in quantity in the bloodstream when it's time for the ovarian follicle to rupture and ovulation to happen. So FSH stimulates maturing of the follicle. Luteinizing hormone stimulates ovulation. The pituitary gland does not produce FSH and LH during pregnancy and with oral contraceptives. Menopause. Menopause is the gradual ending of the menstrual cycle. This can begin between ages 45 and 55, and it can be marked by falling estrogen levels. And there are options for estrogen replacement therapy, but the physician and patient have to consider the potential risks involved. And that completes my section on the female reproductive system. I hope this helped you out. Thank you.